Diarmid, you think you could give it a stab?
Yes, I think on the technical details of that, part of the challenge that we have is that at least for the next 20 or 30 years, we're committed to a certain amount of climate change. What will happen over that period is mainly what has come out of the emissions that have happened up until now. So most of what we need to do in the short term is that protection of the increase in the resilience of health systems and putting into place of protective measures. So it's adaptation to climate change. So we would be able to save almost all of those lives, those 250,000, if we're able to put into place the resilience, the protective measures that we describe in the report. But perhaps the more important figure is the figures are the ones that Maria has been referring to. We know that if we were to put ourselves on a track for staying within 1.5 degrees centigrade, we would be saving over 1 million lives a year by the 2050s just from reduced air pollution, and probably more than that from sustainable food systems. So in fact, over that longer term, it's not so much about saying how many lives would we lose from 1.5 degrees centigrade or 2 degrees centigrade. It's how many lives can we save by all of the measures that we need to put into place to hit those targets. And those numbers are in fact much bigger and much more certain than the ones about the impacts of climate change. Because I would say that as somebody who's worked in this for quite some time now, the challenge that we have with our models is that for the higher end of climate change scenarios, it will do such damage to the environmental systems that sustain our health that in fact it's really difficult to put a prediction on that other than to say we must not go there. It is not negotiable to wreck those systems. In fact, we shy away from making quantitative predictions there and just make it very clear that we have very big health gains if we, from the direct health gains of air pollution, sustainable food systems and so on, if we hit our targets to stay within 1.5 degrees centigrade.
Thank you, and I'm looking if colleagues want to add.
Just maybe, Christian, to put it maybe on a more journalistic approach, I think this scenario is not even to be considered. I mean, for us, it's not considered. We need to accelerate it. That's why we are presenting the health arguments to take action now. We don't want even to look at what it will be the world and how our human health will be affected if we go for a catastrophic scenario that we all know what that means. And of course, health will be the first one to be affected. So not even to be considered that scenario, no way.
Yeah, thank you for this clarification. Next question goes to Jenny Le Ravello from DevEx. Jenny, please unmute yourself.
Hi, thank you for taking my question. According to the report, less than 0.5% of multilateral climate finance is allocated to health projects. Are you calling for a specific percentage to be allocated for health projects? And can you identify examples of health projects should climate finance invest in? Also, often international funding for health and climate is often separate. How do you think this can be more integrated? Thank you so much.
Now, this is nearly a question for all of our panelists. Well, then we start with Dr. Nera again.
Let me start, but well, at the moment, yes. Let me put a figure on the table. I mean, 25% of the global burden of diseases is linked to environmental risk factors that could be modifiable. Is 25 the figure that we would like to see now on the climate finance to protect the health? Maybe this will be too ambitious, but at least more than what we have now on 0.5 and reaching at least a different proportion. What we see now is that everybody recognizes on all of the projects that countries are presenting for obtaining climate finance, everybody recognizes the impact that this will have on the health of the people and how much we need to start to invest, or well, we should have started years ago on making our health system more resilient and our society more resilient to protect our health. But this is not coming yet. Everybody mentioned health, but then when it's about allocating the funds, this is not transferred. Maybe because, as you rightly say, that the environmental community and the health community or the climate community are separate. I think, again, by putting this health argument, giving all of those good reasons to invest, and again, describing the fact that there are no excuses for investments because what's happened until now is that all of those investments and allocation of funds that have been done, including the subsidies, they never contemplate the health cost, the externalities, how much the health sector is already paying. So in fact, as Jeremy said, we could outweigh the cost of what we need to do to mitigate climate change by the cost that we are already paying, not only with our health, but with our economies at the country level with the health system. So all of those arguments are very much in favor of making this COP26 a real health COP and moving quickly and allocating a reasonable amount of funds to the health system to make it more resilient, because 0.5 is definitely not the one that will allow us to make our health system more resilient. But dear me.
Again, just to add a little detail on that, indeed, obviously 0.5% is too low, and it is the case that climate and health funding mechanisms are not well joined up. So that's another thing that we're working on, that we're recommending that we work on. But I think you also asked, basically, do we have examples of effectively what should be done with that money? And I would say that health does have a whole series of, if you like, shovel-ready projects that are ready to go, which would be good investment for any financier. And I'll just give one example of that, and that is building health facilities which are both greener and more resilient to climate risks. So we have examples now from around the world, from rich countries to poor countries, of how you can build or retrofit healthcare facilities so that they're much more resilient when the next flood or drought or cyclone hits. But they also, for example, make use of renewable energy, that they have wastewater recycling, and they have environmental sustainability practices in place. And this is really quite an easy target for investment because it's generally under government control. So I would just say that if that money were to be made available, then health has a whole series of good investments to spend it on.
Thank you very much, both. We have a question from BBC, Paulina Bessina, who wrote it down, and it fits right now because of the figures. So I'll read out the question. And then after this, once we answer that one, if there's to add, I want to go to Dr. Ruth Etzel, who's the chair of the Strategic Advisory Group on Environmental Health International Pediatric Association, maybe to get a touch on the pediatric side of things, to get a different note here. So let me go to BBC first. How many deaths are directly linked to air pollution, ambient and indoors, as of 2021, based on the numbers you have? There are many different scientific research and studies with numbers that vary between 6 to 9 million deaths per year. Is there a more accurate number or estimate that we can rely on, considering the impact of COVID and lockdowns around the world?
I think this question comes to me. Yeah, our WHO estimation is 7 million premature deaths occurring every year. And the figure gets the 4.1 of household air pollution, and a similar figure for outdoor air pollution, ambient air pollution. Of course, you cannot add those two numbers because there is a duplication. Part of the indoor air pollution is contributing as well to the outdoor air pollution. So our latest estimates are telling us that 7 million premature deaths. There are other figures around that, and they include other models, but at the end of the day, the figures are very similar, and for WHO is 7 million premature deaths every year. Thank you.
Thank you. Important clarification. Now, as announced, let me look at Dr. Ruth Etzel for maybe a perspective from her side. Over.
Thank you. I would bring in an important point that I don't think we've talked about yet, and that is the importance of following the lead of the children. Pediatricians are listening to the children, and it's the children who are sounding the alarm. But many adults are hitting the snooze button. The adults, such as government leaders from hundreds of different countries, are continuing to make decisions with their own self-interest in mind, and usually their own term of office in mind. And the children are demanding that they take the long-term view, because decisions that they make today will affect many generations of children to come. And this is not new. You probably remember that 30 years ago at the Rio Conference on Sustainable Development, Severin Suzuki spoke up, and at that time she was only 12 years old, and she demanded that the leaders of the world take action on the climate crisis. And that was before we even had any visible signs of climate change. But now we've got visible signs, and pediatricians are speaking up because we do prevention. We give immunizations to prevent communicable diseases. And we're speaking up now because we know that the health of the people and the health of the planet are one. Many, many generations to come. And we're speaking up because we think it's far past time to allow our leaders to hit the snooze button once again. The time for action is now.
Thank you very much, Dr. Hetzel. We'll go ahead with our questions now, and I have two more, and I think we can fit them maybe into the time frame. The next one goes to Gabriela Sotomayor from El Proceso. Gabriela, please unmute yourself.
Yes, thank you very much for taking my question. The report states that burning of fossil fuels is killing us. And I will say that burning of fossil fuels is killing many Mexicans already. So the government of Mexico insists in going backwards as the world goes forward to cleaner energy. So please, if Dr. Marianera can say a message to Mexico in Spanish, please. Thank you so much.
Hola, Gabriela. Voy a intentar hablar en español. No sé si es mexicano también, pero es un español de España. Espero que os valga también. Sí, el informe insiste mucho sobre la importancia de acelerar la transición a energías limpias, a energías renovables, a energías que no tengamos que quemar para que generen esa energía y además generan una contaminación del aire importante. Hacemos un llamamiento a todos los países y, por supuesto, México también, de que dentro de sus posibilidades, pero siempre pensando en los millones de muertos que están relacionados con esa contaminación del aire, que hagan esa transición lo antes posible, porque el uso de los combustibles fósiles tiene los días contados, nos está literalmente matando. Sí, esos combustibles, esa dependencia que tenemos de combustibles fósiles está teniendo efectos devastadores en la salud de las personas y por eso, desde un punto de vista de salud pública, tenemos que enfatizar la transición lo más rápida posible a combustibles limpios, a energía limpia y renovable. Y México tiene un sol maravilloso que estoy seguro que sabrá utilizar, entre otras fuentes de energía, lo antes posible. Entendemos también que tiene que haber una transición, pero entendemos que hay muchos beneficios para la salud, para la economía, para la sociedad y, por supuesto, para un desarrollo mucho más saludable de todos los países. Pero sí, los combustibles fósiles nos hacen mucho daño a nuestra salud, tienen un impacto muy negativo. Gracias.
Muchas gracias. So with this, we come to what I see as the last question so far, and the honor is to you, John Saracostas from France 24.
Yes, good afternoon there. I was wondering, firstly, if Dr. Campbell could give a few concrete examples of where projects can improve health in sub-Saharan Africa. And secondly, to Dr. Anira, you mentioned governments subsidizing fossil fuels never contemplate the health costs. You've been on this message for quite a few years. What is happening? Who's not listening at the G7 and G20 tables? And is the advocacy not sufficient?
Yes, that will leave us a good closing discussion at the end here. But Dr. Campbell, Landon, please first.
Yes, I think you're right to draw attention to sub-Saharan Africa, along with the small and developing states. It's one of the areas where we suffer the greatest health impacts of climate change. I would say that I'll just give perhaps 3 examples of things that can be done and are being done. One is within the sort of the environmental determinants of health. We know that climate change is impacting on water supplies. It's making water and sanitation less reliable. Increase in floods and droughts are a risk factor for cholera. And yet we've been able to work with several countries within sub-Saharan Africa to put into place water safety plans that also take into account climate risks to basically give a much greater protection against the health impacts of climate change via water and sanitation. The second is on transmission of infectious disease. We see, for example, that climate change is increasing or improving the conditions for transmission of diseases like dengue. Yet we know that we have concrete interventions which can offer a great deal of protection against those. So we know that malaria interventions, bed nets, treatment, and now potentially the malaria vaccine will both drive down the risk of malaria, but also make those populations less vulnerable to climate change. We're also doing work to use climate information to put into place early warning systems so that populations are better protected from outbreaks of disease, including associated with climate risks. And then the third is the example I referred to earlier, the opportunity to invest in renewing or revitalizing the health infrastructure of sub-Saharan Africa, which is a rapidly economically developing part of the world. It has higher growth rates than most other parts of the world. There is the opportunity to leapfrog from lack of health infrastructure or poor health infrastructure to basically the hospitals and health clinics of the future. And we now have the examples and the evidence to say these are the kinds of things you can do to make your healthcare facility or your hospital both environmentally sustainable and resilient to climate risks.
And then we have the second part about who's not listening.
Well, we would like to think that everybody's listening, but maybe they are a little bit slow on the reaction. But I think that the scientific evidence behind that is very clear. Of course, it will need a transition, but we want this transition to be as quick as possible in the name of health. And I think good things are happening now. The European Commission, they have a track on looking at the incoherence maybe between their policies on EU Green Deal and the zero pollution, and some countries are still giving subsidies, and they are trying to align that and make a very coherent approach. There is this zero pollution strategy at the European Union, which we are very keen on looking at that and making sure that there will be a quick transition, and there are many countries that are now advancing. So I prefer to keep on the positive, John, and see that some countries are listening and are moving, and for the others we will keep repeating our message, insisting and making sure that the health argument is very clear for them to finally convince.
And I'll ask Dr. Yamamoto also for...
Thank you very much. And I just would like to add a few words about, especially for the final question. As I said at the beginning, this is a 10 recommendations. It comes from the broader consultation with the civil society, our global health partner, health professionals, and government as well, and our UN agencies. And if you read 10 recommendations on climate change and health, it's kind of the transformative, or we can translate this each recommendation to action at personal level, community level, as well as regional level, national level, as well as global level. So if you continue to do it, even though it's some area, like a food safety area, clean energy area, or community engagement area, we come up with big voices, and definitely we can change the world. Because as Maria and Diamit and Howard said, we're very positive, but optimistic, but also this is a way we have to go. So we will repeat it. Thank you.
We Very good repetition. That's indeed necessary. So with this, we've come through our lines of questions. I thank all the journalists very much. But before we're closing, of course, I would like to ask our panelists, and especially also those who haven't spoken yet, to give a few closing remarks. And I'll start with Dr. Jenny Miller, the Executive Director of the Global Climate and Health Alliance. Jenny, please unmute yourself.
Yeah, thank you so much. And I think the thing that I would just really like to emphasize is what the letter, the sign-on letter, the healthy prescription letter shows is that this is a call coming from across the health community. Our WHO colleagues have talked about the consultation process for the report. That indeed brought in the input of the community, health community worldwide. I think the letter really was needed in order to crystallize that these recommendations are actually a demand from the health community that this type of action needs to be taken. And so the number of health professionals represented has been mentioned a few times, the 45 million, which is, again, just to note, again, that's 3/4 of the health professional community in the world, 3/4 of the health professionals of the world. And we have sign-on from health professionals and health workers representing over 100 countries. We have pediatricians and family doctors that have signed on to this, nurses, midwives, public health workers, psychotherapists, respiratory therapists, allied health workers, health students. It really is from across the spectrum of the health community, a call for climate action to protect health, because the health community recognizes really what's at stake and wants to see this action taken now.
Thank you very much, Dr. Miller. And that was basically a lead directly to Howard Cotton, the CEO of the International Council of Nurses. Howard.
Thanks very much. As Jenny has said, I think if I put it even more plainly, the voices from healthcare professionals aren't going away anywhere soon. And combined with the other voices, the mobilization that we're seeing, this is a powerful, passionate and committed group who are going to hold leaders to account and demand change, because you don't have to think for very long about what the consequences are of doing nothing, what that will mean to our lives, our families and the future generations that are to come. And this is happening on all of our collective watch. Can we afford it? Can we afford not to? Is a key question. Final point from me. I'd just like to just give it this important message around the health financing issue, without a risk of slipping back into a negative perspective. But when we talk about financing health systems, we're talking about our healthcare workforce. They're indivisible. Our clinics, our hospitals, without our health workers, are just empty buildings. There are some incredibly worrying signs about the current state of the global healthcare workforce, their mental health, their physical health, people who are leaving the profession as well. We need the investment in our healthcare workforce. We need to be clear, it's not a cost, it's an investment. And we need to see that mainlined and mainstreamed in health funding in all countries. And I would like to see much more public transparency around some of that data and some of those figures as well, because it doesn't, what people might say in this room doesn't always match what we hear from people in countries as well. And I think that it's a terrible analogy to say we need to hold people's feet to the fire, given the topic that we're addressing here. But yes, our voice, our support, our mobilisation, our commitment and our passion for this isn't going to wither anytime soon.
Thank you very much for this, and I'll hand over to Maria Nera for the closing remarks.
Thank you. It's just to say that I invite once again everyone to please have a look at the health argument for climate action. I think it's very powerful, very motivating, Everybody can use it. Look at the prescriptions, because they are prescriptions, healthy and positive prescriptions. Use it and share with others. And my second concluding remark, Christian, is thank you to every one of the 45 millions behind this report. So how can you not listen to the 45 millions of health professionals? Come on, listen to them and go with the prescriptions they are making, and I'm sure that our world will be better, greener, healthier, and fantastic. Thank you.
Thank you all very much. And for the journalists, there's no more embargo on this press briefing or the report now anymore. If you haven't found it already online, the report, or we haven't sent it to you, we'll send the link together with the press release and the audio and sound files of this press briefing shortly after the briefing. With this, I thank you all very much, the panelists remotely and here in the room. Have a good day.